Greetings, knowledge seekers. You've landed on Brainetainment, your one-stop destination for mind-enriching content. Here we focus on medical and health-related topics, breaking down complex concepts into digestible information. Our aim is to provide students, professionals, and anyone with a keen interest in medical science with reliable, understandable insights. Whether you're unraveling the mysteries of the human body or exploring the latest advances in medical science, Brainetainment is here to guide your journey. Today, we delve into the intricacies of a prevalent health issue, colorectal cancer. Colorectal cancer, a term that may sound intimidating, but today, we aim to comprehend it. Let's start at the very beginning. Colorectal cancer is a type of cancer that originates in the colon or rectum, both key parts of our large intestine. Typically, our body's cells grow and divide in an orderly manner to keep our body functioning smoothly. However, sometimes this growth gets out of control. Cells continue to divide even when new ones aren't needed, forming a mass of tissue called a tumor. When this uncontrolled cell growth happens in the colon or rectum, we refer to it as colorectal cancer. Sometimes you might hear it being referred to as bowel cancer. This is a broad term used to describe cancer that begins in the part of the large intestine known as the bowel. So essentially, bowel cancer is a type of colorectal cancer. Alternatively, it might be called colon cancer or rectal cancer, depending on where the cancer starts. If it starts in the colon, it's colon cancer. If it begins in the rectum, it's rectal cancer. It's essential to remember that not all growths in the colon or rectum are cancerous. Some are benign, which means they are not cancer. These benign growths, such as polyps, can occasionally become cancerous, but it's not a given. Now, why is understanding colorectal cancer important? Well, it's one of the most common types of cancer worldwide. By understanding it, we can better recognize its signs and symptoms, leading to earlier detection. Early detection often means better outcomes, as treatment is usually more effective at an earlier stage. So what have we learned? Colorectal cancer begins in the colon or rectum. It can also be referred to as bowel cancer, colon cancer, or rectal cancer, depending on where it starts. And importantly, understanding it can lead to earlier detection and better outcomes. Now, armed with a fundamental understanding of what colorectal cancer is, we can delve deeper into its causes. Numerous factors contribute to the onset of colorectal cancer. As we delve deeper into the subject, it becomes evident that colorectal cancer doesn't discriminate and can be spurred on by a myriad of causes. Let's take a closer look at some of these risk factors. Our lifestyle choices play a significant role in our overall health, and the same rings true for colorectal cancer. A diet high in processed and red meats, for instance, has been linked to this type of cancer. On the other hand, a diet rich in fruits, vegetables, and whole grains may help reduce your risk. Physical activity too, or the lack thereof, plays a crucial part. Regular exercise has been shown to reduce the risk of colorectal cancer, while a sedentary lifestyle might increase it. Next, we can't overlook the hereditary factors. Around 1 in 5 people with colorectal cancer have other family members who've had it. Certain inherited gene mutations can increase the risk significantly, leading to specific syndromes like Lynch syndrome or familial adenomatous polyposis. Age is another contributing factor. While colorectal cancer can occur at any age, the majority of people diagnosed with it are older than 50. Lastly, having certain types of other diseases can also increase the risk. Conditions like chronic inflammatory bowel diseases, including ulcerative colitis and Crohn's disease, have been associated with a higher risk of colorectal cancer. It's important to note that having one or more of these risk factors doesn't necessarily mean you'll get colorectal cancer. Conversely, some people who get the disease may have few or no known risk factors. The myriad causes of colorectal cancer make it a complex disease to combat. But understanding these factors is a step in the right direction. It helps us identify those at risk and take preventive measures when possible. Understanding the causes provides insight into prevention, but to stop a problem, we must also recognize its signs. Identifying colorectal cancer early can significantly improve the prognosis. But how do we identify it? The answer lies in understanding the symptoms and getting a proper diagnosis. Colorectal cancer, often silent in its initial stages, can present a wide array of symptoms as it progresses. These symptoms can vary greatly from individual to individual and are also influenced by the stage of the disease. The most common signs include changes in bowel habits such as diarrhea, constipation, or narrowing of the stool that lasts for more than a few days, rectal bleeding or blood in the stool, persistent abdominal discomfort like cramps, gas, or pain, a feeling that the bowel doesn't empty completely, weakness or fatigue, and unexplained weight loss. However, these symptoms are not exclusive to colorectal cancer. They could be due to other health conditions. Hence, it is essential to consult a healthcare professional if you experience any unusual or persistent symptoms. Now let's talk about diagnosis. If your doctor suspects colorectal cancer, they may recommend one or more of the following tests. The first is a colonoscopy, where a long flexible tube is inserted into the rectum to examine the colon. If any suspicious areas are found, a biopsy can be performed during the procedure to collect tissue samples for analysis. The second common diagnostic method is a CT scan, which provides detailed images of the inside of your body. This can help identify any tumors or abnormalities. Blood tests, such as the CEA test that checks for a specific protein in your blood that may increase if cancer is present, can also be used in conjunction with other tests. Remember, early detection is crucial. If you notice any changes in your health, don't hesitate to consult your healthcare provider. They can guide you on the best course of action based on your individual circumstances. Symptoms and diagnosis are crucial, but what happens after a diagnosis? Let's explore the treatment options. Treatment of colorectal cancer is multifaceted, considering personal and medical factors. Just as every individual is unique, so too is the approach to treating colorectal cancer. The treatment plan is tailored to each person, taking into account their overall health, the stage of the cancer, and personal preferences. First, let's talk about surgery, the most common treatment for colorectal cancer. This involves removing the cancerous growth and a portion of healthy tissue surrounding it. The extent of the surgery depends on the stage of the cancer. In early stages, a minimally invasive approach might be suitable, such as endoscopic mucosal resection or laparoscopic surgery. However, in more advanced stages, more extensive surgeries may be required. Radiation therapy is another treatment option, often used in conjunction with surgery. This method uses high-energy rays to kill cancer cells. It's typically used before surgery to shrink large tumors, making them easier to remove, or after surgery to kill any remaining cancer cells. While radiation therapy can be quite effective, it does come with its own set of side effects, including fatigue and skin changes. Chemotherapy, the use of drugs to destroy cancer cells, is another widely used treatment. It can be given orally or intravenously and works by targeting rapidly dividing cells, a characteristic of cancer cells. Chemotherapy can be used before surgery to shrink tumors, or after to kill any remaining cancer cells. Side effects can include fatigue, nausea, and hair loss, but these are usually temporary and subside once treatment is complete. Immunotherapy is a newer field in the treatment of colorectal cancer, using drugs to help the body's immune system recognize and attack cancer cells. Side effects can vary widely, from mild flu-like symptoms to more serious immune-related conditions. While these treatments can be effective in fighting colorectal cancer, they do come with risks and side effects. Therefore, it's important to have a thorough discussion with your healthcare provider to understand the best approach for you. While treatments can be effective, prevention is always better than cure. Let's take a look at preventive measures. Preventing colorectal cancer involves proactive measures and regular checkups. Now, one might wonder, what are these proactive measures? Well, they include maintaining a healthy diet, rich in fruits, vegetables, whole grains, and low in processed meats. These dietary choices can have a profound impact on your colon health. Next, regular exercise is key. Whether it's a brisk walk, a run, or a game of tennis, physical activity can contribute to a healthy colon. So let's get moving, shall we? Then we have regular screenings. Now, this might sound daunting, but it's an essential safeguard. Regular colonoscopies, especially for those over 50, can detect precancerous polyps, allowing for early removal and preventing progression into cancer. Let's summarize what we've learned. We've uncovered the mystery of colorectal cancer, its causes, symptoms, and diagnosis. We've explored the various treatments available, from surgery to chemotherapy. And finally, we've highlighted the importance of prevention through a healthy lifestyle and regular screenings. It's been quite a journey, hasn't it? But remember, this is just the beginning. Knowledge is not a destination, but a path. It's about understanding, about asking questions, about staying curious. So yes, understanding colorectal cancer can seem overwhelming, but with the right information it becomes less daunting, more manageable. We can take control, make informed decisions and potentially save lives. Remember, knowledge is the first step towards prevention. Stay curious, stay educated. That's a wrap on our deep dive into colorectal cancer. We hope it's been enlightening. We appreciate your time and interest in this crucial topic. Remember, knowledge is power, especially when it comes to our health. Please consider sharing this video. You never know who might find it beneficial. Don't forget to subscribe to Braintainment for more insightful content. Until next time, keep your brain in the game.